and to inform her about, you may go into preterm deliveries or preterm babies. So I think we have to start before even marriage. Again, I go to focus on the high school. We do have a smart generation, so we can educate them. This is the first thing. The other thing, if a lady has the risk that she may have to go into preterm, of course, it is our responsibility as a health team to educate our pregnant ladies, because we will be held responsible that if a mom misunderstand things which we have to take care of those babies. I'm always saying, even for my junior staff, I said, we pediatricians, we are the kids advocate. We are the lawyers for those kids. In fact, I mean, parents sometimes they can do off things. I mean, it's just 2 days ago I came across 2 babies. I mean, in the same clinic, 2 babies. They came in with their parents, different families, and because their kids has some colics, there is something called 90 days colics, infantile colics. Some young generation, young couples, they don't comprehend each and every single cry of those babies is part of their colics. So they took that girl to somebody to cauterize her. So that girl, she came into my office and she has too many cauteries in her tummy. And I do know that it is part of the cultural thing. So I was a little bit harsh with them. I said, this is considered in Western countries a kind of child abuse. Although you went there because you are seeking help, but you are compromising this baby's health. If she grow up and she asks you, Mom, what is this scar in my tummy? What will be your answer? This is always my question. If you're going to give her the chance or the choice to choose not to be cauterized, she will say no. So it's not something I have to inherit it and to grow out. So I think the young generation, they have to use their mind.
I think it's grandmother myth.
It is. I think, with all the respect for our all grandmothers and fathers and so much, in olden days, so many things nowadays has been changed. The presence of vaccination, the sickness. I mean, when the World Health Organization announces that there is no more smallpox, there is no more polio in the region, it didn't come out of the blue. Part of it is that education and to vaccinate the whole community.
And that brings us to a question about the polio, the vaccinations message that has been circulating in WhatsApp and other social medias, where people they transfer a message that it is some countries that are prohibiting vaccination and such thing. What is your input on that?
In fact, this is the burning issue nowadays, almost for the last 3 or 4 days. We as pediatricians, it's something, again, the smart phones or the new internet medias, it's a weapon of 2 arms. So I think there is a message nowadays being spread around that please do not get your vaccination, and because there is something. In fact, with all the thanks to the Ministry of Health in Kuwait, they issue that the Assistant Undersecretary that there is nothing to do with the vaccination. All our vaccination in Kuwait are being tested and proved to be safe. The problem with the people, when they spread those type of news, I do understand their concern about their families and for their kids, but at the same time they have to receive the message from the proper sources. I mean, they don't have to spread somebody who just texts something like a viral. So, I mean, let's spread the good news. Why we have to spread the bad news? The bad news says that if you're going to give type of vaccination, your kids will become autistic, for example. Or if you're going to give this type of vaccination, your kids will get sick. This is, you shouldn't spread it around, except if it comes from an expertise, and that expertise, he or she should represent the ministry. Now the the Ministry of Health under the investigation to chase who just released this type of messages.
So it's the message is totally false.
It is absolutely false, and people or our dear viewers, you can go to the Ministry of Health Twitter account and you can go there. Instead of spreading a WhatsApp messages unnecessarily, so from this live studio, I have to inform all my parents, my patients, that vaccination is so safe in Kuwait. Although I am not representing the vaccination or immunization committee, but being a pediatrician, concerning about my own patients, I have to give them the safety message that all our vaccination in Kuwait are safe.
Thank you, Doctor, for assuring the viewers. We got a question from our viewer, Walid. She was asking, since we were talking about premature babies, what does premature mean? Is it a deformed baby or born before his age? And is there growth retardation? It will be with the baby for his whole life until he became adult and such. And what is the chances to get a premature or deformed baby?
Right. Again, we have to differentiate between prematurity as a definition and a deformed or a congenital anomalies babies. Preterm, as the term itself says, it's a pre, it comes before term.
Yeah.
So the definition of the World Health Organization about the pregnancy, it's that it's a pregnancy till the 37 weeks until 42 weeks. Anything less than 37 weeks considered as preterm.
Yes.
Even if it is a 36 plus 6 days, 36 weeks plus 6 days plus 23 hours, we have to consider him as a preterm. Because why on earth this lady went into a preterm delivery?
Exactly.
So preterm can be inherited, or there are women are prone to have preterm babies. But there are things, even if you investigate all the risk factors, sometimes you reach for no answer. Why this lady went into a preterm?
Yeah.
But the majority of the time, if she has an extensive, for example, exercise, or she did have some urinary tract infections, or she have some bugs there and there, so she is at the risk. If a lady, this is again the question comes in, what is the relationship between handicap rather than to be deformed or retarded? A handicap preterm baby can happen, but nowadays, alhamdulillah, with the new technology, we do have 600 grams babies, we do have 700 gram babies. In olden days, almost for the last 15 or 20 years, rarely, before 20 years, we have less than a kg and 200 grams used to survive, intact survival. But nowadays we are talking about 800, 900 can be born and we can take care of them. But for each and every single, thing, there is an exceptions. Of course, 800 or 900 can go home intact survival, provided that all the condition prior to delivery was optimized. But if she came in suddenly and mom, she was bleeding, or she been involved in a road traffic accident and so on and so forth, even for a 2 kg or a 3 kg, he or she will not be able to survive. Again, prematurity is we can treat it as, or considered as a normal kid, provided that boy or girl, they went through a normal, not a stormy course in our ICU. Mind you, preterm babies, they are more prone for infections. Preterm babies, they are more prone for delayed tolerance their feeds. Their immunity has been little bit compromised. And there is a difference between a boy and a girl, even in their way of how to cope with the life. Boys are more prone for infections. Boys are more prone for delayed in their speech, delayed in their milestone, compared to girls. Again, if preterm babies, I'm not talking about 29 or 30 weeks. At 32, 33, 34 weeks, they can be okay, provided they don't spend that much in the ICU, and they were okay without infections, and they tolerate their feeds. But generally speaking, preterm, we shouldn't consider any preterm baby to be handicapped just being a preterm. A preterm will be handicapped if he or she, for example, has an intraventricular hemorrhage. And not any intraventricular hemorrhage, because we do have 4 types of intraventricular hemorrhage. It's a bleeding inside the brain. Those type 1 and 2 will be okay, but the 3 and 4 and extension will have some sort. This is why my message for each and every single parents who's watching us tonight is that please don't let your kids, especially the preterm babies, the first 2 years not to be followed. They have to be followed. Because there are soft signs. Nobody will be able to pick it up except an expert who works in the ICU. Although we in Kuwait, we are few of us who are specialized in this field. But again, if we will not look after those small kids, when they will come, the community will be full of them. So there are things which we can do it and prevent the complications.
Exactly. We have a question also from our viewer Fatma. She is asking if her first kid was a premature. That is it a rule that all the future kids, they will be a premature as well, or not?
Again, the question for Madame Fatma is that when she has her first kid as a preterm, what was the circumstances? I'm not sure what kind of circumstances. Maybe she was in a trip, or she was lifting something heavy, or she was having an infection. But if generally speaking, she has no other thing except that she went into preterm labor, again, the risk will be 3% that the next delivery will be as a preterm. And if she got, and she will be if she's unfortunate to have that 3%, so after the second baby, the chance will go up to even 6 to 10%. So it's not an inheritance thing, but it's a risk sort of things. So our recommendation is always that not a preterm by itself is a risk factor, but we have to be careful why I went. And this is always I'm saying for each and every single mom. If you didn't know why you went into preterm, you have to insist to your obstetrician that why I went to have a preterm baby.
To seek the cause of it.
Sure, and to prevent the next time. Because, for example, there are some moms